Okay, thank you, Seth, and thank you everybody for being here today. We are excited to present this webinar. We want to start this webinar by getting your perspective. I know it's been a challenging 19 months, but the last 19 months have also provided opportunities to learn. So we're interested in finding out what lessons have you learned and how has this changed the way that you work? So please use the Q&A box and tell us what lessons have you learned and how has the way that you work changed? We'll read some of those responses in just a little bit. The Council on Quality and Leadership accredits organizations all over the world with more than 350 accredited organizations. This includes 4 different countries and 25 states. CQL Accreditation provides a variety of benefits. I'm going to highlight one of the most important benefits, and that's quality. Accreditation supports organizations to enhance the quality of their services and supports, and in turn supports people to have a higher quality of life. This is true for organizations, both large and small, regardless of what services are being provided and where the organizations are located. The one thing that connects all of us is people and our ability to impact their quality of life. Okay, so Kendra, did we get some responses?
We got a couple. So a couple of things that we heard are increased appreciation for technology. Virtual contact has been almost the only contact. I have learned how to work more independently, as well as how to manage my office from home or work. We have learned that much of our work can be effectively done if people on both sides have technology. And the importance of timely communication while working remotely is something that people have learned too. The restrictions over the last year enlightened me on the importance and delicacy of communication.
Okay, great. Yeah, it's certainly lots has changed in the last 19 months. Thank you, everybody, for sharing your perspective. So just to give a little bit of context, no matter what industry you work in or what role you play within that industry, there is a very good chance that the work that you do and the place where you do that work looks very different than it did at the start of the pandemic. We have a great quote here from Jim Laurie, CEO of Stanley Black & Decker. The future of work will look like a more caring and compassionate place where employee well-being is prioritized. We've been mindful of the pressure and challenges our people face, and we're committed to a culture of respect, inclusion, engagement, and well-being for all. Today, we hope to provide you with a bit of background on our journey through these last 19 months and highlight how we pivoted to virtual accreditations. We will review some of the benefits and challenges of a virtual model and discuss what the future might look like as we look towards being able to once again engage through travel and on-site visits with partners and people. So let's start with a bit of background and context. In 2019, CQL staff visited 188 organizations in person. We traveled a lot. In terms of an initial response to the pandemic, first and foremost, our priority was to ensure the health and safety of our partners, people receiving support, and our staff. In March of 2020, in response to spreading COVID-19 infections around the world, we suspended travel and immediately pivoted to a virtual model. While this was a necessary response to a global pandemic, it did provide us with an opportunity to reimagine much of what we do. We have certainly learned a lot since March 2020. While we were forced to stop travel in response to a global pandemic, many activities continued virtually, while some were postponed or rescheduled to allow organizations to implement their own crisis response. Our goal has always been to support organizations to move forward while being sensitive to challenges they are facing. CQL was already a virtual organization prior to the pandemic in that our staff members were already working remotely, but much of the services we provide were on site and in person. The pandemic provided us with an opportunity to reimagine much of what we do. Early on, we discovered what worked and what did not work in a virtual setting. Meetings to discuss policies, practices, and systems, organizational presentations and stakeholder meetings, and even personal outcome measures interviews all seem to work quite well in a virtual setting. We learned quickly that having multiple people together in the same room using a video conference screen does not work well. And though many of you have probably tried it, we do not recommend Zooming while driving. Later on in the webinar, we're going to discuss the benefits and unique challenges of facilitating accreditations in the virtual setting. Alongside accreditation, we have adapted virtual trainings as well, including the Personal Outcome Measures Workshop. CQL invested in technologies such as Microsoft Teams, Zoom, DocuSign, and JotForm to improve efficiency and connect with our partners. While virtual accreditation is different, we are confident that this model allows us to be equally effective in evaluating, measuring, and supporting organizations to pursue best practices. We have now conducted 179 entirely virtual full accreditations and 91 accreditation check-ins since March of 2020. We've used what we've learned to continue enhancing our tools and our process. We also recognize that individual organizations are the experts on how to best connect with their stakeholders. We seek input and guidance from every organization on what is going to work best in terms of how to facilitate accreditation activities, which technology to use, and how to support people to participate effectively. One unique benefit that less travel has provided is more availability to connect and support our partners. You have likely heard us talk about the CQL partnership. This partnership is a source of pride for our staff, and we are committed to supporting every organization, not only during their accreditation, but ongoing and throughout the accreditation cycle. We are always willing to connect, share, and strategize to support you to achieve the best possible individual and organizational outcomes. I will now turn it over to Gretchen Block, our Director of Partner Engagement, to discuss our virtual transition.
Thanks, Mike. Okay, well, everyone, and for those of you that have spent time with us over the last 19 months, I know you've seen many similarities. There's certainly some differences as well, though, when preparing for a virtual versus on-site accreditation. We still need that request for engagement, and that is our application for accreditation. We would like to see that from organizations a good 5 to 6 months ahead of when you'd like your first visit. That gives us plenty of time to plan. We'll get you scheduled. We'll send you a letter of engagement. You'll have a planning meeting with myself. During that meeting, we will confirm dates and deadlines, accreditation team members you'll be working with, and activities, the schedules, things that we will want to do with you during that visit. Things like focus groups, personal outcome measure interviews, tours of support locations. And yes, we do a lot of those virtually nowadays. We review the basics of portal during your planning call. We will talk about that online data system and how you will use it to complete your basic assurances self-assessment. There will be other assessments potentially, depending on the type of accreditation you apply for. And that planning call will also include tips for effectively preparing for your visit, and we'll capture any and all questions that you have. So that hasn't changed at all. We'll still prepare effectively together. Then we'll get you connected with the person leading your accreditation activities. You will have a quality enhancement specialist that will reach out to you to support you and your organization as you prepare. A draft schedule is completed, technology platforms are selected for activities, and lots of document sharing happens. Typically, the quality enhancement specialist will schedule several meetings, phone calls, whatever you need to make sure that you are prepared as you lead up to that first accreditation visit. Accessibility is absolutely prioritized for all people, and we hope to capture as many perspectives as possible. We support people to participate by providing several options to access accreditation activities, things like calendar invites, hyperlinks that will be received in an email and will be included on schedules. We'll also support people if needed simply by picking up the phone and chatting that way. Technology, is fantastic, but the phone works great too. As we approach every accreditation, we try as much as possible to remain flexible with scheduling, technology, and truly understanding that when people are working from home, for example, you may not have that dedicated office space that you do at work. It is okay if the cat jumps on your keyboard. We'll wave and say hello, and then we'll move on to our next activity. Okay. We do strive to be flexible and absolutely avoid being prescriptive when identifying the technology platforms that will be used to facilitate your successful accreditation. You'll see everything listed. We take an all of the above approach in order to facilitate broad and diverse participation. We want to meet the needs of everybody that is participating. Some of the technology that we use, well, Zoom has become a household name for sure. We use that platform for most of our accreditation activities, and they work great for, Zoom works great for factor meetings, focus groups. This platform has proven to be very reliable and accessible. There's lots of options to access meetings, and we love the built-in features that enhance accessibility. Our quality enhancement specialists do have access to their own Zoom accounts. Microsoft Teams is another one that is becoming an emerging favorite. We use this platform to connect with organizations and have done so since the onset of the pandemic. A lot of our partners are starting to use Teams and use it very well. Organizations that are already using Teams or are willing to give it a try, we might set up an accreditation site, a team site to communicate, collaborate, and share documents. It works very well for sharing documents. We've got our portal system, that proprietary database that is used for personal outcome measures interviews, and that's where you'll be completing your basic assurances self-assessment. CQL staff will validate your self-assessment within that system. The portal database can also be used as a platform for sharing documents, and we'll talk more about that in a little bit. Much of our initial communication will absolutely be conducted by email. For most accreditations, we like to send Outlook calendar invites for accreditation activities, and then we ask organizations to forward those to everyone that wants to and needs to participate. Once again, can't stress enough, we want to and do prioritize accessibility and flexibility in order to support all people to participate effectively. For virtual tours and conversations, chats, one-on-one conversations with people, we have used a variety of other platforms, not just Zoom and Teams. We have spent time with FaceTime, Skype, Messenger, RingCentral. Our partners in Canada love Blue Jeans. We are open to your suggestions. Let us know what works best for you, and we will take a look at it. We want the platforms that are used to be comfortable for the organization and work well. This quote from our partner Mark Keeley at the St. Louis ARC. highlights how well virtual experiences have helped us gather information. He indicates that the self-assessments led to them hosting virtual meetings during our review week to validate those self-assessments. We've had some fantastic virtual meetings with partners, and want to pause a moment and thank everybody that has participated and helped us through this virtual world. Everyone that we've worked with has really done an exceptional job, and we appreciate that very much. Okay. For those of you who have participated in accreditations prior to the pandemic, you will remember stacks of documents, racks of binders, folders upon folders. Obviously, this is something that has changed significantly in response to the pandemic. Organizations are sharing this information electronically now, and we are happy to be more green. We work with organizations to identify the best platform for that document sharing. Each of the systems that you see here, they offer unique strengths and benefits. The portal system that we've talked about, you can upload documents directly into the database in conjunction with completing your basic assurances self-assessment. The advantage to using Portal is that you will already be accessing this system to complete your self-assessment, and the process to upload the documents is pretty straightforward. Please note that once you have completed your self-assessment and you hit submit, you won't be able to get back in there to load more documents unless you ask for special access. Microsoft Teams, another great one, easily accessible platform for uploading and sharing documents. We love the flexibility, and we know that a lot of our partners do too. Documents can be uploaded right up to and during your accreditation visit. Documents can be organized in folders connected to the basic assurances, policies and procedures, or any other category based on what makes sense for the organization. Some organizations choose to provide limited access to their own internet servers or cloud storage systems and upload documents directly into these systems for the accreditation. For those organizations that use these systems, it's typically the easiest way to share docs, as organizations will already have extensive familiarity with these systems. We're happy to do that when requested. Organizations may also provide us with access to their electronic health record systems, and that way we can go in and review individual records, incident management, and other data, and it's easily accessible through those systems. Works really, really well. Again, want to stress that we will be flexible and happy to go with whatever works best for organizations. Let us know and we will make it happen. So consistent with in-person accreditations, all activities are scheduled and customized and facilitated in a way that will meet the needs of each and every organization we work with, and of course, the type of accreditation you are pursuing. While this is not an exhaustive list of accreditation activities, it does represent the core activities that are typical of most accreditations. The initial gathering, organizational presentation, opening meeting, whatever you want to call it, this is your opportunity to share successes and challenges. It's a time for reflection with an expectation of full transparency. Agencies are typically provided with 30 to 45 minutes, or frankly, however much time you need to share information regarding your mission, your vision, your values. We want to hear about services that you offer, whatever you feel is noteworthy to help kick off the week. As with in-person accreditations, the style, format, and content of these presentations absolutely varies from organization to organization. Consider including diverse perspectives within your organization. For virtual accreditations, these presentations are typically facilitated via Zoom, and we love it when they include slideshows, videos, picture stories, and most importantly, encourage a variety of presenters. The more people that we can hear from and spend time with during an accreditation, the better. Factor reviews. This is a great time to collaborate. These meetings are typically attended by organizational team members who have the expertise or perspective in relation to the factor being discussed. CQL staff will ask questions, we will share feedback, resources, provide support. You can recommend the platform that you feel will work best for you for this type of activity. And as mentioned previously, people logging in and using their own devices does help ensure that we can hear everyone's responses and questions. And by the way, this is also a great time for organizations to ask questions of CQL, seek clarification, discuss ideas. You've got experts in front of you that week, definitely take advantage of that. Focus groups, they are facilitated with people that an organization supports, frontline workers and staff, frontline supervisors, perhaps families, and sometimes case managers or community partners. With the right support, all people truly have been successful in engaging with us through virtual focus groups. We've been able to actually also include more one-on-one conversations during an accreditation visit, simply because the time is more flexible. We're not traveling, so we might be able to sneak in a few more chats with people. Virtual tours, they are facilitated in people's homes, programs that an organization provides, and other places, as we work with an organization that we deem important to stop by and say hello. Frankly, we've always been more interested in people than buildings, but what these virtual tours do is give us a chance to see where the work is done, but just as importantly, talk with people that are present during those tours. This gives us a chance for conversation as well as observation. Most often, a person will use a portable device, their smartphone or their tablet, to hop on video and show us around. People receiving supports absolutely have full discretion over what we see and perhaps what they prefer not to show us during a tour. And we'll just chat with everybody that is around and wants to say hello and see as much of the space as we can. Usually virtual tours, especially at a home, last maybe 20 minutes or so. They're very efficient. Then we've got personal outcome measure interviews and targeted conversations with people. The POM is a powerful tool. It helps us understand services and supports through the absolutely essential perspective of people who receive those supports. CQL staff and provider organizations are successfully facilitating these conversations in a virtual setting. They are really going well. It's important to be sure that people are supported to become familiar with whatever technology is used, to choose that technology, get the support that they need, and that POM interview and conversations happen where people want them to happen. Have a private, quiet, comfortable space for these things to occur. Then we've got the stakeholder meetings. These are also highly customizable. And of course, that's based on the size and scope of the organization, as well as the organization's goals. We absolutely want this to be a collaborative experience, and it has been despite the virtual setting. And we're using tools such as interactive polls, annotation, and breakout rooms to collaborate on goals for the future. And quite frankly, most organizations have found that even more stakeholders are able to attend these meetings because, if they weren't able to travel to be in person, now they can attend virtually. Finally, next step conversations, closing meetings, wrap up, whatever you'd like to call it. This is designed to bring the accreditation full circle. We're going to spend some time together talking about strengths and opportunities and next steps for the accreditation. And we absolutely want you to set aside time that last day to celebrate all of your accomplishments. As Mike mentioned, it has been a challenging 19 months, and you deserve to sit down, take a deep breath, relax, and celebrate.
Thank you, Gretchen. So I would like to discuss with you guys some of the benefits that we've experienced since switching to a virtual model for the pandemic. So as you guys know, some organizations are quite spread out. Some organizations are far away from major airports. Some organizations, just support a few people in a really remote settings. So now with being able to do things virtually, geography and travel time have been less of a barrier for us and for organizations. So we're conducting accreditations at multi-state organizations and those that are, all over the place in vast geographic areas. And we're able to cover a lot more ground because we don't have to spend any time traveling from place to place. We aren't spending so much time behind a windshield or in a plane. And we're able to visit some places that we might not have visited otherwise, just because we're able to connect, instantaneously rather than having that travel time. And likewise, because we're not spending time traveling from place to place, we're able to cover more ground overall and spend more time with people rather than behind a windshield. CQL staff members all have travel stories about trying to reach some remote place during a blizzard in January, probably in the Dakotas where I live, if we're being honest. And we could probably do an entire webinar on that. So virtual accreditation has really allowed us to be with your organization on time, every time, and not had any travel disruptions based on the weather. We have more flexibility in scheduling activities because we don't have to worry about travel time or other factors. We can schedule activities at times that are most convenient to the people that need to be a part of those conversations. And that being said, we're also able to capture the perspectives of more people during those focus groups and stakeholder meetings. Focus groups can now be attended by everyone, wherever they are. It's often more convenient for organizational staff members, people, their families, and community partners to attend those focus groups. Often family members and community partners are attending focus groups from their jobs rather than having to come to an office somewhere. And family members don't always have to live close to their loved ones. So this allows them to participate in the process to the fullest extent possible. And you guys know that travel is very expensive. So not traveling results in cost savings for organizations and less environmental impact. We're not printing as much, we're not copying as much. That's also providing a cost savings as well. And frankly, it's much more environmentally friendly not to be making those copies. We'd be remiss, though, if we didn't talk about some of the challenges that, of course, we are facing with the virtual model. So we anticipated that there would be challenges, right? We didn't go into this thinking there wouldn't be. Many of our ideas of what might be a potential challenge never really came to fruition. We expected that people may not be willing to share about themselves or connect with us in a virtual format. We were worried that we wouldn't be able to get enough information about organizations' cultures, and some of our early accreditation activities show that because we were being really, really careful trying to make sure that we captured it all. But those challenges didn't happen as much as we expected. However, even in 2021, after almost 2 years of a pandemic that has pushed most of us to move some of our lives, activities, and connections online, not all people have access to broadband internet or an internet connected device. So we really want organizations to consider supporting people to have access to Wi-Fi connections or borrow an internet connected device to mitigate those challenges. For some people receiving services as well, their finances may be limited to the point where, yes, they have an internet connected device, but they don't want to use all of their data talking with us. So really being cognizant of that has been really important throughout all of this. We've also been impressed by the ability of all people to adapt to the increased use of technology, but we do understand that technology related comfort level and expertise continues to vary from person to person, and some people may require more support to participate in activities. Some people may be less comfortable appearing on camera, and screen fatigue is an issue for some people. So again, this is where our flexibility comes in. We don't require people to be on camera during those conversations that we're having with them. If people are more comfortable with phone calls, we can do that as well. We really want to meet people, where they are and where their comfort lies. And I think we miss some of the things during virtual tours that we typically, be able to smell. They're baking fresh bread. Or last week I saw that everyone's enjoying supper and I couldn't smell it, and that was so sad. The overall vibe of the place might be harder to assess as well. And we're just not able to use all of our senses in the way that we typically would while we were visiting a place in person. So this is a quote from Susan Arwood, the executive director at Core Services of Northeast Tennessee. And she said, "The review went flawlessly despite the fact that we were coordinating dozens of Zoom links." And I don't think we ever counted how many Zoom links there were for that accreditation, but it was a lot. The organization did a fantastic job. You guys can review that accreditation article. Seth just shared the link in the chat. And I'm going to turn it back over to Mike.
Okay, thank you, Kendra. So now we want to review some tips for success. when using virtual platforms. All right, while accreditations are based around organizations, it is important to begin with the basic premise that organizations are centered around people. So it is critical that we identify the best way for each person to participate. People have varying comfort levels when it comes to technology. Some people may be more familiar with a certain technology or app. People might prefer participating from a certain location where they are more comfortable or can have privacy. We encourage organizations to connect with people prior to their accreditations to find out what is going to work best for them. People may need support to access meetings, log in, set up accounts, or just for reassurance. People may need support to gain access. According to Pew Research, over 20% of Americans still do not have broadband internet access at home. People may need to access a location that has access to high-speed internet. Others may need to borrow an internet-connected device. With the exception of those few organizations that have invested in high-tech conference rooms intended for video conferencing, it is often better for everyone to participate in meetings from their own device in a quiet, private, and comfortable setting. When multiple people are attempting to participate from the same room, it is often difficult to hear everyone and even more difficult to figure out who said what. It's also important that we support people to lead activities. We are most interested in people and their perspective. It is important to give people you support and other stakeholders the opportunity to play a leadership role in your accreditation. This will not only help us to understand more unique perspectives, but will enhance buy-in to the process overall. We encourage organizations to be flexible. Prepare to be flexible in terms of how and when people are able to participate and access meetings. And when all else fails, we can always connect with people through a simple phone call. Sometimes it's better for some people to go low tech rather than high tech. And finally, most importantly, don't expect perfection. As useful and ubiquitous as it has become, virtual meeting platforms are certainly not perfect, just as people's ability to use these platforms is not perfect either. Have the expectation that not everything is going to go as planned. We would never expect every activity to proceed flawlessly, whether we are connecting with you virtually or in person. We are focused on supporting you to provide the highest quality services, and I can promise you, we will not remember all the times people forget to unmute themselves before trying to speak in a Zoom meeting. We got this great quote here from Thane Dykstra, President and CEO of Trinity Services in Illinois. Trinity was reaccredited earlier this year, and they were able to involve a broad and diverse perspective of people from all over the state of Illinois because they were very intentional in finding out what would work best for each person participating. We met with people young and old, people with varying types and levels of support, people with varying roles within the organization, and lots of community partners that work to support the organization's mission. Another tip for success, frequent communication. It is important to have multiple modes of communicating. While our meetings and other activities will primarily take place via a video conferencing platform such as Zoom, we will also communicate with organizations through email, phone calls, and text. CQL will typically set up multiple meetings prior to the accreditation to support organizations to prepare, and we encourage organizations to reach out when they encounter challenges before, during, and after the accreditation. We typically find that organizations need encouragement to celebrate organizational and individual success. Accreditation is a journey, and the expectation is that you will never reach a final destination. Rather, keep moving forward as you continue to learn, adopt, and implement best practices. That said, there are milestones along the way that are worthy of celebrating. It should be recognized that the way that we celebrate might look different now. It may not always be safe to have a physical celebration with a large group of people. Consider all of the tools that you have at your disposal to recognize individual and organizational achievements. Social media, agency-wide emails, town hall meetings, or in-person meetings with small groups of people. We encourage you to be creative. Intentionally celebrating will increase buy-in and morale and keep the momentum going.
So the big question that everyone has is, what does the future hold for CQL and for accreditations? So like other companies and organizations, we have used the pandemic as an opportunity to rethink the way that we work. We have learned that many valuable lessons, adopted new tools and technologies, and we can be even more efficient and effective in supporting our partner organizations. While some activities will return to a similar format as they were prior to the pandemic, we plan to use what works best from both the in-person and virtual models to create the best possible accreditation experience going forward. Of course, we're always going to stay true to our vision and mission. So let's revisit that for a second. Our vision is a world of dignity, opportunity, and community for all people. So no matter what the future holds, we'll always be looking forward to what it looks like to have a world of dignity, opportunity, and community for every person. And we'll always continue to be dedicated to the definition, measurement, and improvement of personal quality of life throughout our journey in the future. So the questions that you guys really have here is, what does virtual accreditation look like in the future? And we're thinking probably a hybrid model. So when it's once again safe to travel to our partner organizations, we will proceed with a hybrid model of accreditation, sending the minimum number of staff members needed to conduct accreditation activities effectively. Accreditation leads will be working with organizations to determine which activities would receive the most benefit from on-site staff and which activities would be better suited to be conducted virtually. There's not really a one-size-fits-all for this. Schedules and activities will be designed to maximize efficiency and keep diverse participation involved. And of course, the health and safety of everyone involved will be considered and prioritized. So we want to capture the best of both worlds here. We want to use everything we've learned since March 2020 to continue to support organizations in the best way possible. But accreditation will also involve some of those things that we feel like we're missing from not being able to do it virtually. You know, being able to use all of our senses and those kinds of things and connect with people in a way that's most comfortable for them. We want to value being efficient. So we'll strive to be efficient with time, money, and other resources when planning each accreditation. We want to be flexible. So accreditation schedules may look different in order to accommodate both virtual and on-site activities. Where past accreditations typically occurred over the course of consecutive days, there may be times when it is more beneficial to utilize a more creative approach. You know, we will work with each organization to design a schedule that is most effective and conducive to maximum participation of all types of people. We also want to value teamwork here. So we may bring in additional staff to do on-site activities based on their proximity to the organization. This is where we've really taken an opportunity to grow and expand ourselves and take a hard look at how can we support organizations in the way that's the most efficient and, you know, foster that sense of teamwork. We want to continue using document sharing the way that we are currently. So the days of those large stacks of paper are for the most part over. There may be a few organizations or situations where that still makes sense, but sharing documents electronically will really ensure that accessibility to virtual and on-site staff is most beneficial to the environment, and it reduces printing costs for organizations. So you guys aren't having to, you know, make all those copies or, you know, give us access to your only copy if that's the case. And most accreditations will proceed using that hybrid model. So some accreditations might be fully on site and some may continue to be fully virtual. It'll be determined on a case-by-case basis, taking into consideration a variety of factors, including the organization's accreditation standing and status, the services that are provided, and the outcome of previous accreditation visits. You know, as the pandemic continues as well, we'll also be taking into consideration what the situation looks like with the pandemic as well in, you know, the local area where the organization is located, just to make sure that everyone can stay safe in those situations. For the most part, documents will be continued to be shared electronically, with the bulk of those documents being shared by the organization, you know, prior to the start of the on-site review. That allows us to be really efficient with your time because we can do the document review prior to the start of their accreditation visit. And it allows team members who are working on site and remotely to access all of the same documents, no matter where we are. And it's important that we maximize the availability of in-person visits to focus on people and services rather than reading documents while we're there. That's just not a good use of resources and in-person resources. And those exceptions, again, could be made based on those unique circumstances at the organization. We have developed a set of guidelines to ensure the health and safety of our partners and our staff. Those guidelines include, the necessity or request of some organizations to be on site, what kinds of things the organization is doing to mitigate the chance of exposure to our staff and to other people when we're visiting with people. You can really review everything in our protocols for in-person activities that Seth just shared in the chat box if you have any questions. But they really include all of our concerns about how to keep people safe while we're on site with you guys, okay? So when we're looking at organizations that may have a full on-site visit, that might include those small organizations where the review team consists of just one CQL staff member. So, it's not really possible to do that virtually and on site. It may have, part of it may take place ahead of time, part of it may not. It just really depends. The organizations that have not demonstrated evidence of progress during a previous accreditation cycle will need to have an on-site visit. Organizations that have received those letters of jeopardy, significant findings related to health, safety, abuse, or neglect, or those that are at the discretion of the Council on Quality and Leadership or government oversight agencies, that we really need to fully assess services through an on-site review. And that will be communicated to the organization while we're scheduling those things. And organizations in good standing may continue with the fully virtual reviews for now. And that could include organizations that do not provide any facility-based services, such as organizations that solely provide case management, employment, or other community-based supports. We want to focus on continuous learning with the hybrid model. So while we've learned a lot since March 2020, we continue to learn and implement new techniques, technologies, and practices. Okay. So this next page covers some of the safety guidelines. So we're going to follow the most current guidelines that are based on this COVID-19 safety guidelines and restrictions. Those vary from place to place. So we're going to follow whatever is the strictest, either the provincial or state or local level or the national level, whatever keeps people the safest. That includes mask wearing, social distancing, hand washing, etc. Those decisions about travel will be made by CQL and the organizations together. We will take into account when we're making our decision based on various factors, such as if the location has that high transmission rate or a spike in COVID cases. If it is safe to travel, CQL will only send the staff members necessary to conduct the specific in-person activities. CQL will only send staff for in-person activities who are fully vaccinated. We also, part of our protocol includes COVID symptoms and testing. So if our CQL on-site staff begin to display any COVID-related symptoms, so those kind of cold symptoms, fevers, etc., they will not participate in any of the in-person activities. If CQL staff are scheduled to be on site test positive for COVID within 2 weeks of an in-person activity, they won't be allowed to travel at that time. The activities will then need to be rescheduled or conducted virtually. If CQL's on-site staff have been potentially exposed to COVID within 2 weeks of the on-site activity, they won't be allowed to travel either. But we're also looking at that time afterwards as well. So if we display those afterwards or test positive, we'll let you guys know, the organization know via email within 1 business day of that, those symptoms or the positive test, okay? We would like to mitigate risk with everything we're doing. So we are aware of and sensitive to those related risks as well. And we're also sensitive to you guys' comfort level with direct interactions. So we're going to do everything we can to keep those things in place to support people to feel comfortable with the level of interaction. There might be unexpected changes, right? We reserve the right to change any in-person activity to a virtual activity. That will be communicated as quickly as possible. And we'll also have a backup plan if we do need to pivot to a virtual accreditation. We also expect our partner organizations to take steps to mitigate risk and maintain the health and safety for everyone participating in on-site accreditation activities. So similar to our own protocols, we expect the organization to follow guidelines issued at the national, provincial, or state or local level, whatever is the strictest. That includes mask wearing, social distancing, hand washing, etc. Organizations are welcome to request information about the vaccination status of the CQL's on-site staff that are planned to visit. And for the purpose of contact tracing, in the event that someone tests positive for COVID, the organization is expected to keep records of who was present, so employees, people supported, and those other stakeholders as well, for all in-person activities. And if within 2 weeks following an in-person activity, anyone from the organization who the CQL on-site staff member had come into contact with either displays COVID-related symptoms or tests positive for COVID, we would like the organization to notify Gretchen Block, CQL's Director of Partner Engagement via email within 1 business day of that taking place. Okay. So we've covered a lot in this webinar, so we'd like you guys to share any questions you have now in the Q&A, and we'll answer those really quick here. But you guys can also connect with us on Facebook, on Twitter, on YouTube, and LinkedIn. We regularly post a lot of resources, articles, and other information for human service providers. We also encourage you to join our e-community on Facebook, where members can share resources, ask questions, provide support, and identify solutions for common challenges. And Seth just shared that link in the chat box for you guys. You can contact the 3 of us as well directly with our emails, and that's Gretchen's email if you have any questions about our COVID procedures.
So excellent presentation by you 3. Really, really valuable information. We do have some questions that were asked. I'll do my best to direct them to the right person. So Gretchen, I'll send this one to you. So the question is, are CQL reviews moving forward going to be virtual, in that the date being February of 2022?
Thanks, Seth. And I think that question came in before Kendra shared some of our next steps. So hopefully that clarified quite a bit of it. We are planning actually to hit the road in January 2022. So if you've reached out to me, if you've had a planning call with me, you've had a planning call with the person leading your accreditation activities for 2022, you know that we are taking a look at the best model for your visit. And every organization does look a little different. We do have a few that are still fully virtual. We have some that are completely on site, and we have the hybrid model as well. So we'll talk amongst one another and work together with your input to set up the schedule that's best for everyone involved.
Great, thanks, Gretchen. The next one, I guess I could kind of go to anyone. Will the virtual time frame be similar to an in-person accreditation, or will it be more broken up?
Well, so we are definitely prioritizing flexibility, and I know this answer sounds like a cop-out, but it really depends. It really just depends on what's going to make the most sense for your organization. There is value in keeping things relatively compact, but there's also value in getting a variety of different perspectives as well. So we just work with each organization to design the schedule that's going to work best for the organization.
And I think just to add to that, considering the work that our quality enhancement specialists are doing before and after your accreditation, for the most part, I think we'll see a similar schedule as if it would have been on site. We also have some partners that we can call upon to help an accreditation team out. Perhaps a personal outcome measures interview can't be scheduled during your week of accreditation, but someone's available to talk with us the week before. Mike might call on one of his colleagues to get that scheduled outside of your regular visit. He's absolutely right. We will fully tailor it to what works best for the organization and getting the information we need.
And another question, I can't help but give a shout out to Gretchen. The attendee Noel said that they were planning for their reaccreditation for June of 2022, and the planning call with Gretchen was very helpful and answered many of our questions. And I just want to, sorry, I had to say that just because we do hear that a lot from organizations. They really do value those planning calls with Gretchen. It gets a lot of the information squared away. We know accreditation is a big undertaking, but we're here to help and guide you along the way. There was also a question tied to that, and I'll direct that to Kendra and Michael. They're a very large organization, and do we have a limit on the number of people for the focus groups?
So to answer that question, it really depends on your organization and what makes the most sense for you guys. We can, facilitate multiple focus groups if that works better. Often what I do with really large organizations is I may have a focus group for people receiving services during the day, and then a second one during the evening. Same with staff. So whatever really works well for you, just let your quality enhancement specialist that's assigned to you know what you think will work well, and we'll work with you guys to figure that out. With those virtual ones, we do find that when they start to get really big, it can be really hard to understand and hear people and have people not talking over each other. So, it is best to kind of limit the size of the individual focus groups, but we can certainly add a couple more if we need to accommodate more people and get a better cross section. So.
Kendra. And then, so of course, please submit more questions if you have them. This is the final question that we currently have in the question and answer box, and I'll direct it towards Gretchen. Does CQL accredit multi-service organizations that provide a range of human services, including children and youth, mental health, etc.?
We absolutely do. So if you are interested in chatting more about the services that you offer and making sure that it's in our wheelhouse, please reach out to me. You can use my email. I believe you'll see my phone number on the website as well. Happy to talk with you about what you're up to and how we can partner with you.
That's all the questions that we have currently. Maybe we'll give everyone just a few more seconds to decide if they have any questions they want to ask. But like Gretchen had said, of course, you can get in touch with us directly and we can respond to those. As many of you may know, because some of you may have been previous attendees of some of our accreditation webinar series, we've also shared a lot of information over the last previous 4 sessions, this being the final 5th. So of course, we would encourage you to check those out as well, because there's a lot of information on tips for preparing for accreditation, the tools that we use. The first session was just kind of a general overview. We had one presentation devoted to the use of data with accreditation. So there was a lot of information that was shared through those sessions that would be valuable for all of you attendees to check out as well.
The other thing I would say,
yeah, sorry, go ahead.
while we're waiting, the other thing I would say, every time an organization achieves accreditation and you receive your awards letter and certificate, you also get a link to a survey. This would be a fantastic time to take advantage of that and share your feedback as CQL continues to evolve, and figure out what the best way to do business post-pandemic will look like. Share the good things and all of the recommendations you have for us. We really appreciate that.
I also want to mention, and I think we touched on this a little bit throughout, is, the flexibility doesn't end when the visit starts, right? If we start with everything planned to go a certain way using a certain platform and we find that's not working for the people you support, we can pivot, in the middle of an accreditation if we need to. We can change timeframes. We can do what we need to do to support you. So, don't feel that you're trapped into a schedule when the accreditation visit starts, because you're certainly not. Okay.
There's always some tweaking that happens, right, Kendra?
More often than not.
Mm-hmm.
We did just have a question come through. Someone who had asked about any thoughts on Canadian international accreditation. I defer to Michael, but in general, we do provide accreditation for organizations throughout Canada and have had virtual accreditations that have gone successfully. I don't know, Michael, if you want to add anything to that.
Yeah, I'll start by welcoming my Canadian friends back to the US. Our borders opened back up yesterday, so welcome back, everybody. But yeah, in addition, Canada specifically, we do have Canadian consultants as well. So, we're not impacted by border closures and the like. So, we do have Canadian staff that are available to travel. And we conduct virtual accreditations, virtual training with organizations in other places as well. Ireland, New Zealand. So certainly, yeah, we can certainly do that as well.
Great. Well, I'm not seeing any other questions coming in. Michael, do you want to go back just one slide, just have all the contact info in case you want to get in touch with you? So if there's no more questions, I just want to thank our presenters for the wonderful presentation today, all the great information shared, and I especially want to thank all of the attendees for coming out today and checking out this session. Again, a reminder, we'll be sending out a link to all registrants sometime next week with the link to the webinar recording, as well as a PDF version of the PowerPoint slides. Anything final words from Kendra, Michael, Gretchen?
Thank you, everybody, for attending. Always feel free to reach out. We're always happy to collaborate.